we would have seen over the last, I think, week or so that a new hospital has been launched by the previous president. Well, what we have there is an absolute disaster because we have spent $1.6 billion and we literally have a shell. You have a building, there's no equipment, no bed. That building is supposed to house 197 beds. The beds, you got different types, the regular ones, the ICU, high dependency beds. For example, in the ICU, I think they were catering for about 20 adult beds, and they had another section for about 10 pediatric beds. But one of the requirements, a basic requirement of an ICU, is to ensure that you have centralized oxygen, suction, and those types of things. Now, you don't want to wheel in a 200-pound cylinder and put it next to the bedside, because every time you do that, the risk of infection and those things goes up in a unit like this. So the ideal is to make sure that these things are constructed and put into the walls, and you have outlet that come from the wall. That wasn't done. So we have refurbished this place and forget to put in all the essential things that are required for a proper ICU. So to utilize that building, we'll probably have to go and break those walls to install these kinds of pipes and outlets and so forth. So it's a lot of money, I would imagine, to go renovate. So I have a technical team that has started to look at some of those things, what we need to fix. We have spent $1.6 billion. Not a single piece of equipment is there. If you're going to treat COVID, severe COVID patients with complications and so forth, as you know, you need ventilators, you need a whole set of things. Nothing is there. So to buy those things, we have to buy them, put them in place. We'll have to buy the consumables. And those two, I'm trying to get a cost.